building a better Bay Area for a safe and secure future. This is ABC 7 News.
Our task is so urgent that under Operation Warp Speed, the federal government will invest in manufacturing all of the top vaccine candidates.
The Bay Area has been chosen to participate in one of 5 national vaccine trials.
This is a really pivotal moment for us here in San Francisco.
You look at the number of deaths, like over 1.3 million worldwide, and I just think, what can I do to help?
We have some breaking news right now, and this is the news that we've been waiting for the past 24 hours at least, but the FDA has authorized the first COVID-19 vaccine.
There's 327,600 doses of the vaccine on their way to the state of California.
It literally gives me chills.
Medical workers from Contra Costa to San Francisco breathe in a sigh of relief as they get the first doses of Pfizer's COVID-19 vaccine.
We need to vaccinate a significant number of people in this country, including those who are hesitant.
It's two-sided for me because it was kind of quick. So the skeptic in me says, oh man, it's kind of quick. Did they go through the proper checks, the proper channels? Then the second half of me is like, yes, now we're going to finally begin to slowly reopen. Yes, now we have some hope.
But history will record that this week was the beginning of the end of the coronavirus pandemic.
And it's important with all the enthusiasm about the vaccine is not going to bend the curve by itself for a couple of months. So we've got a couple of tough months ahead of us.
Thank you so much for joining us for this special edition of ABC 7 News. I'm Kamasi Aaron here with my colleague, Kate Larson. And instead of our normal 4 p.m. newscast, today we are spending an hour engaging experts and you in an ABC 7 virtual town hall. Now, today we are focused on the COVID-19 vaccine. It's something that Kate and I, really our whole ABC 7 News team, have dedicated months to covering as part of our efforts to build a better Bay Area.
Absolutely. This is an important 1-hour virtual town hall airing on TV, on ABC7News.com, YouTube, and Facebook. Over the next hour, we will have a thorough conversation focused on questions from all of you, our viewers. We have received hundreds of thoughtful questions this past week, so thank you so much for participating in this town hall in advance.
First, though, we want to give you an update on the developments with the Moderna vaccine. We're expecting to hear whether the FDA will grant it emergency authorization. It is anticipated that that will happen sometime today after the vaccine was given the thumbs up by an advisory committee. If it does move forward, the first doses could be delivered by Monday. The FDA authorized the Pfizer vaccine last week.
All right, now we're going to get to our fantastic group of panelists. They will be answering the questions that you've been submitting all week long. First off, Dr. Arlene Brown with UCLA, who also leads a statewide coalition focused on how COVID impacts disproportionately affected populations. Next, Dr. Bernard Lowe with UCSF, an expert on bioethics research. And Dr. Art Reingold, a professor with UC Berkeley School of Public Policy. Dr. Reingold has been working on infectious disease policy for decades. Thank you all.
Also joining us is Dr. Reed Tuckson with Tuckson Health Connections, a consulting business that's focused on prevention, public health, and care delivery. And a face that is familiar to our ABC 7 News viewers, Dr. Alok Patel, ABC 7 special correspondent and physician. Now that we've introduced you to all of them, I want to get straight to our first question. And we've really gotten so many different versions of this question, but this particular one comes from George. So he says, I work out in the public. He says, I'm considered an essential worker as a driver for waste management. I would like to know, how soon can I get vaccinated? We've gotten so many emails about this. People want to know, where are they in line? And Dr. Reingold, I want to start with you. Is there an answer to this question?
Well, there is, but it may not be very satisfactory. I think the reality, I actually checked for myself when I would be eligible for vaccination. I went online to the New York Times and put in my figures, and they said I was 120 millionth in line nationally. The reality is that I think the person you described, assuming they don't have a lot of underlying health problems, is probably a couple of months away from having access to the vaccine. I'm apparently about 3 months away, but it's going to be slowly growing, but it's not going to immediately meet everyone's needs right away.
I think the thing that has a lot of people confused is their underlying conditions, whether they're like George, if they work as an essential worker. They're wondering, how do all these factors play into when I'm going to be able to get it? And Dr. Lowe, I'll ask you, do we know at that point the specific factors and how they play into when people will be able to get the vaccine?
Not yet, but there's a committee that Dr. Brown and I serve on in California to make recommendations that really give a fine-grained prioritization. And that we haven't made our final report, but I know this is something that the governor is very concerned about. I also want to say that it's really hard because so many people are essential workers. There isn't enough vaccine to go around at this point. And so we really have to look at who's really at high risk in terms of not just having to be on the job, but also the number of exposures to other people and whether a lot of those exposures are to COVID positive people.
One thing I would just sort of say is, as we think about this person and this essential work that he does, and that is that we all as fellow human beings have an obligation to him to make sure that we are doing what we're supposed to do in terms of wearing our masks and providing physical distancing. As we talk to people who do this kind of work every day, they often complain that the selfishness of others puts their health in jeopardy, and then they have to go home to their families, and they are terrified when they go home that they will bring it into their house. So I really appreciate this story about when they'll have access to the vaccine, but in the interim, let's make sure that we're treating fellow human beings who do this essential work with fairness and not give them or spread the vaccine to them because of our inappropriate behavior.
Well, and thank you all so much for those answers. The other risk factor besides being an essential worker are people with compromised immune systems who have comorbidities that put them at risk for a worse COVID outcome should they get the virus. And so Terry sent us a question that is part of this whole topic that we've been discussing. She says, I'm 76 years old, a cancer survivor, and have 2 plates in my back. My children believe I'm at risk. And if so, when should I expect to receive the vaccine? And this is another important part of this question. Assuming she's getting it several months from now and Moderna gets EUA today, will she have a choice of either the Pfizer vaccine or the Moderna vaccine? Dr. Reingold, what do you think?
So let me answer the last part first. I don't think we really know the answer to the last question, but I suspect that no, you will not have a choice. That is that when you show up at a provider who has the vaccine, they're going to have one or the other. And not say, would you like A or B? And I would just point out that there may be a third vaccine coming online perhaps by March. So it's going to be a complicated situation, but I doubt that people are going to get to make a choice of which vaccine they want unless somebody else on the call knows better than I do.
Well, Dr. Brown, I was sort of wondering, since you're a general internist, are you hearing a lot of these concerns from your own patients, people who are older, who have health risks?
Absolutely. This is a big concern for patients with, particularly those with many chronic conditions like diabetes and heart disease and obesity and immunocompromise. And what Dr. Reingold said is exactly correct. You won't have a choice as far as we know about which vaccine you get. The other thing I would add is the evidence we have to date suggests that the vaccines, both the ones that are going to, both the Pfizer and the Moderna, which will be available, both operate at have very good characteristics and are equally effective. So, and there's no evidence that things like race, ethnicity, or other factors make a difference in terms of how effective those vaccines are. And it does not appear that the types of chronic conditions you have make a difference how effective the vaccines are. So we do think that even though they're 2 separate vaccines, they seem to work comparably well. And so that's actually really good news for my patients.
Yeah, that is good, because we just got a question from Scott Hutchinson on Facebook who wanted to know if there were any studies about how the vaccines interact. So I'm glad that you addressed that, Dr. Brown. I want to get to another question now from Laura, and this is really coming down to the logistics of making sure that people get both shots of these vaccines. So Laura asks, how are hospitals, doctors, et cetera, going to make sure that people actually get the second vaccine shot? What are the procedures in place to make sure that this actually happens? And what if people don't get the second shot?
You know, I'm curious to hear what the other panelists have experienced, but regarding what I've heard from my colleagues and including the listservs I'm on for the hospitals I work at, a lot of it right now is being set up through the electronic medical record systems, or what we use in the hospital to kind of sign up for the vaccine. And then a reminder is sent out not only for when you're scheduled to get your shot, but a reminder sent out for 4 weeks later if you're when your next dose is. It's actually 3 weeks with Pfizer, 4 weeks with Moderna, if and when that goes through, which I suspect it will. And I'm curious with the public what they're going to do in terms of a reminder system. If it's going to be something that's widespread, is it going to be an app? Is it going to be set up through a patient portal or something through their hospital? But I think at the end of the day, awareness is going to be a very important factor here, especially with people who may experience a response, an immune response. And I want to make sure I call it that, not an adverse side effect, but a normal response to the vaccine, that they know that's okay, and they still need to go back and get their second shot, because people do need both to get the full efficacy from it.
Well, and Dr. Patel, I was speaking to Dr. Matt Willis, who's a Marin County Health Officer, and he was saying that they will be making follow-up calls and text messages and emails to everyone. But it's important that people get that second shot within a few days of a narrow window. It needs to be 3 to 4 weeks later, depending on the vaccine. What happens if it doesn't happen, if they don't get that second booster within that narrow, 4-day window?
So let me take a crack at that. I think the quick answer is it probably doesn't matter that much. That getting the second dose at 5 weeks instead of 4 weeks, or 4 weeks instead of 3 weeks, is still really important. So if you miss by a few days or even a couple of weeks, it's still important to get the second dose. And as far as we know, that won't really affect the level of protection you get from the second dose. But Dr. Patel is quite right. The second dose is important. And I think different people in different health systems will be getting different types of reminders. But there really will be a good system in place for tracking and encouraging people to come in for that second dose.
Well, that is definitely encouraging. So happy even just with the first 10 minutes of this conversation, and we have so much more still ahead, including more of your questions. And then we're going to dive deep into any potential side effects of the vaccine.
And of course, we want you to continue to join our conversation. You are part of this ABC7 Town Hall too, a very important part. So please go to Facebook or YouTube and weigh in and interact in today's virtual town hall. And we're going to continue this conversation right now on Facebook and YouTube. All right, if the panelists are still here, I believe we are still live on Facebook and YouTube, so hopefully we can get in a few more questions for all our online viewers. Just to sort of continue with the topic of logistics, maybe we can talk about how complex, particularly with Pfizer, also Moderna, but less so, how this works in the healthcare setting in terms of getting it out of the freezer, letting it warm to room temperature, giving it in the appropriate amount of time. It's a very, very complicated process right now. Dr. Tuckson, I thought maybe you could take a crack at this.
Well, it certainly is a complex situation. And what it also means is that it defines what practitioners will be able to participate in the dissemination or in the vaccination campaign and which ones will not. Given the heavy freezer requirements, it makes it pretty difficult and impossible for ordinary physician offices to be involved in this process. And so it will mean that there will be a very narrow window of places that this will be able to be administered. That's not necessarily a horrible problem. It's one that can be worked out, given the earlier answer, in terms of the interconnectivity between the physician's offices and the vaccine settings. But also, we know that the Moderna vaccine will be one that does not require such heavy levels of refrigeration and will have more availability of treatment and vaccine sites options available.
Well, and Dr. Brown, that's what's very exciting about AstraZeneca. If we ultimately get to EUA for AstraZeneca, and then also Johnson & Johnson, I know we're expecting data on the J&J phase 3 trials early next year. So Dr. Tuckson or Dr. Brown, I'm curious what you think about those two vaccines, particularly when it comes to equitable distribution. It's good to have vaccines that are easier to distribute and, of course, a lot less expensive than Moderna, which is in the $30 range per dose. I think AstraZeneca is $3 to $5.
And I think one important thing that we should make clear right now is that at this stage, the cost of the vaccine is covered. And so it's really important for people to realize they shouldn't make that cost be a reason for not going to get the vaccine. The other issue, I think, though, is that something like the Moderna vaccine, which requires, Pfizer vaccine and Moderna, which require much more stringent conditions for maintaining the integrity of the vaccine, is a less optimal option than a vaccine that you can store at much higher temperatures. So it would be wonderful if the other vaccines were available. Right now, however, we don't have that option available to us.
One thing that was inside of your question was the issue of equitable access, and hopefully we'll be able to come back and talk about that.
Oh, we will. We have a whole block dedicated to equity. So we'll definitely talk about that as part of our television broadcast too. And I think we're about to go back on.
About 10 seconds.
That was a long commercial.
Welcome back to our COVID-19 vaccine town hall. Regional Medical Center in San Jose started vaccinating its workers this morning. The first person to get immunized was a nursing team leader. Now, this hospital in particular has been hit really hard by the pandemic, with its ICU beds reaching capacity last week. Santa Clara County received about 5,800 doses of the Pfizer vaccine this week, and the state and the county has slotted for more than 17,000. Now, we know with this first batch of doses that we've been seeing here around the Bay Area, we know that the focus is for our healthcare workers, but a lot of people have been sending in questions to us wanting to know, how do they get on a list, or how can they make sure that they are in the lineup when it's time for them to get the vaccine? And I want to pose that to our panel right now, because is there even a list to get on, or is this something that people's doctors will reach out to them about once they're available? We've also been hearing about people being able to go to, Walgreens, just different things. What should people know about making sure that they are ready when the vaccine's available for them?
I think the answer is stay tuned. There'll be a lot of different channels to inform people. If you are part of a healthcare system that has a good electronic records communication program, they will be trying to take the lead in informing you when your turn comes up. But a lot of this may be based on what kind of job you have. And there'll be public announcements as to, is it school teachers? Is it farm workers? Is it grocery clerks? And I think you'll just have to look and see what the current information is. There won't be, it'll be really impractical to verify what people say. So we have to depend on everybody to be honest about whether they really belong in that group. But we're still working this out, but there'll be lots of different ways you can get informed when your turn is up, so to speak.
Well, and Susan sent in a question. She said, who is administering vaccines at Walgreens and CVS, and are they prepared to recognize and manage a vaccine reaction? I think to our panelists, a lot of these questions are coming after there have been some healthcare workers who have had some allergic reactions. We know in the healthcare setting that they are being monitored for 15 to 30 minutes after the vaccine. How will that happen at a Walgreens or a CVS when these vaccines get rolled out to the general public?
So I would say that all the sites that are administering this vaccine are well prepared to handle emergencies or adverse effects of the vaccines. Individuals should rest assured that there are people who are trained in how to deal with emergencies. Those emergencies are very, very, very rare. And so I think the other issue that came up, I think, in this question is who's administering the vaccines. And it's important to recognize that places like CVS and Walgreens pharmacies have been administering vaccines for years. So they administer flu shots to many of my patients because it's more convenient for them to have this done in the community. And it also is a way to ensure more equity, because if you can go to a local pharmacy to get the vaccine, it may be much easier for some patients rather than coming into a health center.
One thing that patients also should remember is that they will be required to wait at least 15 minutes after they have gotten their shot so that the medical staff will be able to monitor and watch. And also, any site that is administering these vaccines will have and must have on hand the appropriate equipment and drugs in case of the very rare anaphylactic or allergic reaction that we're seeing. And so the system will be well prepared for those kinds of contingencies.
And I just wanted to quickly add to what Dr. Brown was saying. If you look at the vaccines we currently administer, the chance of getting an anaphylactic or that severe reaction is about 1.4 per 1 million doses, so extremely rare. And a lot of people were concerned by that headline about the healthcare worker in Alaska who had a severe anaphylactic reaction. The one silver lining of that headline is the system worked. The healthcare worker was taken care of. Symptoms were recognized within 10 minutes. And after, I believe it was, I don't remember what type of healthcare provider she was, but she even said afterwards, I feel great. I got the shot, and the system designed to catch these rare reactions, it worked.
Well, we have this question from Sherry Howell from Facebook, and it's about people who've had some ongoing symptoms of COVID, even after testing negative. She says, do you have any thoughts on individuals with long COVID symptoms being vaccinated? Would the vaccine potentially exacerbate their ongoing symptoms? And what do you think about this? I'll ask you, Dr. Brown, or anyone who wants to jump in on this.
So we know that patients who have had COVID and who have recovered from it may or may not have antibodies. And in those cases, we don't recommend that you wait on getting the vaccine. We recommend that you get the vaccine because we don't know how effective that immunity is. Patients who have symptoms but have never tested positive, that's a harder question. And I think it's really important for individuals to work with their primary care doctors and or infectious disease doctors to determine whether or not they should get the vaccine. But I think that should be dealt with on a case-by-case basis.
The other part of this question that we've heard from a lot of people is the issue of, can you actually get COVID from the vaccines? There's no live virus in any of the vaccines.
That is correct. You cannot, categorically, you cannot get COVID from the vaccine. It is as straightforward and as simple as that.
If I can just add to that, a lot of people are concerned about it. And I've even heard some people say, is this a plot to make people sick? People like me, are they trying to make me sick? And so I think we really have to address that concern in the whole context of what's been going on in this country. But Dr. Tuckson's absolutely right. The answer is NO in capital letters.
I want to ask another question that we got from Aziel. She says, I have autoimmune diseases, as do both of my kids. My son also has severe asthma. Is the vaccine okay for us? What do you tell your patients who may have those specific health concerns or other concerns?
I'll speak regarding generally her and also her child. And the overall point right now is we still need to wait before we have more data from trials involving children. I don't know how old her child is right now. There's some trials involving children as young as 12, but obviously put forth by pediatricians like myself and the American Academy of Pediatrics. We need to get younger children in there if we're going to get them vaccinated in time for next school year. As far as the underlying condition, that doesn't preclude them from the trial. If anything, and Dr. Lowe or Dr. Brown can weigh in on what the committee is going to decide. If anything, that might push them to a higher bracket, given the fact that they're predisposed to more severe illness.
That's absolutely right. I mean, one of the factors in determining the priorities is your susceptibility based on the medical conditions you have that put you at risk. And I would just say that when the turn comes for this woman and her children, and their pediatrician says it's safe, they should get the vaccine because they're at higher risk for getting complications because of their underlying conditions.
Dr. Lowe, I don't envy you. Oh, go ahead.
So I agree with that, but I just wanted to point out that for the woman herself, who's an adult, that at the moment, the only recommendation not to be vaccinated would be in somebody who's clearly had an anaphylactic response in the past. But for other types of medical conditions, it's not currently believed that those would be a contraindication to receiving the vaccine. And as Dr. Lowe said, these may be people who are at greater risk of getting very sick if they get infected. So we do want them vaccinated.
I think about it like the flu shot. People who are at high risk, we push them to get that shot early. Same thing that I anticipate we're going to be doing with the COVID-19 shot.
So we've also been getting a lot of questions about the cost, and we covered this a little bit during our Facebook segment a few moments ago. But Becky on Facebook asked, how much will the vaccine cost for someone who is uninsured? And then Paula via email also asked, will the fee be coming out of pocket? Cash she'd like to know beforehand. I know healthcare workers right now, they're not sharing their insurance information. Everything is covered. But what about 3, 4, 5, 6 months from now when this is rolled out to the general public? Will insurance cover it, or will the government cover it?
We know that the insurance will also cover it, and that people will not be paying out of pocket for this to be vaccinated. There may be, on rare occasions, someone with a very peculiar kind of insurance policy that could possibly not cover this, but it is so unusual that for the overwhelming majority of people who have insurance, they will not have to pay for the cost of the drug, nor will they have to pay for the cost of the administration, and they will not have to be paying co-pays either.
I'm sure that's very reassuring to hear.
Yeah, I completely agree. And the one thing I would add to that as well is that for uninsured patients, there are federal programs that will cover the cost of the administration of the vaccine. So that, again, should not deter individuals from going in to get the vaccine. The out-of-pocket cost should be virtually nothing for most people, as Dr. Tuckson said.
Well, thank you so much for answering those questions. We have so much more ahead, a lot more questions from you, our audience, including more on whether or not your employer can force you to get the vaccine.
Absolutely. We've got much more to come. And remember, you're part of this ABC 7 Listens Town Hall too. So go ahead to our Facebook page or YouTube to weigh in and interact in today's virtual town hall. We're going to be live on Facebook and YouTube in just a moment again.
All right. I have a question that kind of goes back to a conversation we had at the top of the show about tracking the vaccines. The question is, how accurately will you be tracked to make sure that your second dose is the same vaccine as your first, particularly if you don't know which one you got on the first dose? So I want to ask our panel that. Is that true? Will you not know which one you got, or will your doctor inform you? And can they be interchanged? Oh, I can't hear.
We don't want people getting one dose of one vaccine and another dose of another vaccine, because we simply don't know what the effects of that would be. In general, there are going to be different approaches to tracking people. If they're in Kaiser, they'll be tracked by Kaiser. If they're in different systems, but among the other things, a fairly primitive system of giving people a card that tells them exactly what they received on exactly what date and exactly when they're supposed to come back. It's a little old-fashioned, but that may well be how some people make sure that they get their second dose of the right vaccine at the right time.
We've seen those cards being proudly shown on social media at people who are getting those shots. And those cards are really important, as Dr. Reingold mentioned, for people's own personal records. But right now, when I vaccinate children, and we look at records in our medical record systems, it not only shows the name, the generic name of the vaccine, it also shows the type. In the event there's a question about that as well.
Yeah, so it's just like you won't have a choice, but you will be aware of what is going in your body.
And I would also say that, all states, including California, have immunization registries. And certainly the intention is that every dose delivered will be in that registry and will be available for healthcare providers to check.
So that even if, I was just going to say that even if you have to go somewhere else for your second dose, they can see the registry information and know what dose to give you, what type of vaccine to give you.
Oh, that's really helpful, because I'm sure people are wondering if they have to go to the same doctor, the same strategy when they got the first dose. So it's good to know that they have some flexibility and some options there.
Well, and just to say, this will be an issue, for example, there will be quite a bit of immunization of people in long-term care facilities and nursing homes and the like. And it turns out that not everybody in those facilities is there for the rest of their life. There's quite a bit of turnover. A lot of people are there for a shorter interval of recovery after being in the hospital. And so if they get their first dose in such a facility, they may need to get their second dose somewhere else.
Well, this is good information. We have about 20 seconds left before we go back on air. So we want to wrap up this part and get ready for our next section. We're going to be talking about equity. So I'm really excited to chat about that. We've gotten a lot of questions about people wanting to know, how all of this will weigh into who gets the vaccine and when, and just concerns about that. So I'm excited about that conversation.
It's been such an important part of this entire conversation about the pandemic, and we're going to get to it right now on TV. Here's a scene being played out all around the Bay Area. Frontline healthcare workers receiving the COVID-19 vaccine. ABC 7 News was in Santa Clara as some Pfizer doctors, nurses, and respiratory therapists and others got their shots at 6:30 this morning. They say the vaccine gives them and their families peace of mind. We've seen thousands of healthcare workers across the country successfully get the vaccine this week in Kumasi. It's been an important part of our conversation here at ABC 7. How can we equitably distribute the vaccine so it helps the communities most in need? Because we know that certain communities, the Latino community, the Black community, have been harder hit than others during this pandemic. And a viewer, Chris, sent in a great question. He said, will this initial distribution have an inconsequential effect on surging infection rates? Infections of specific age and race groups are causing a spike, so wouldn't vaccinating them make rates go down? Dr. Tuckson, I'm curious what you think about that.
African-American community and other communities of color that have suffered so much disproportionate impact from this disease and who have such high rates of underlying pre-existing illness that makes them predisposed to having bad outcomes when infected by this virus have the chance to be early in the line for vaccinations. I was on a committee by the National Academy of Medicine that helped to make the allocation framework recommendations that ultimately went to the federal government and are now being passed down to the states. And we made a very clear point that people with two or more chronic illnesses need very much to be near the top of the line. And that includes a lot of people of color. Very quickly, the other side of the coin, though, is that there are a lot of people of color who are predisposed not to take the vaccine as they do not quite yet have the level of confidence. And so it's a double-edged sword. On the one hand, feeling that that people of color are being used as early guinea pigs, others are being understanding that fair, equitable access is also important. I think we will see the curve trend towards having fair, equitable access early on.
Yeah, Dr. Tuckson, I wanted to ask you that because I did a story this week about why so many in the African-American Black community are hesitant to get the COVID vaccine. And I wanted to ask you, what impact do you think that hesitation can have? And what do you see being done to address it, specifically with the Black community, but also we see some hesitation within the Latino community too, and all of it's important.
For very important and legitimate historical reasons, people of color have a reasonable concern about the way they have been treated by the American research enterprise going all the way back to the 1930s with the famous or infamous Tuskegee syphilis study and other insults. Finally, in addition, we are seeing as people take to the streets to proclaim that their lives actually matter in this society, those elements bleed over into the healthcare system. So there are real reasons why there are concerns. However, if those concerns are not addressed by the actions of our officials in our public health departments, by our elected officials, if we're not addressing the African American and Latino communities from a position that says we are actually trustworthy people who respect and care about you, the consequences will be that there will be a great level of vaccine hesitancy, and that inevitably means people will become sick, they will die, they will not have access to their businesses surviving in their communities, workers will lose their jobs, and their children will not be going back to school. So the consequences of acting on distrust really have horrific outcomes.
If I could follow up on that, those are really important points that Dr. Tuckson made. I just want to say on the California Vaccine Working Group, we're spending a lot of time and thought on this very issue. and this will be a very central part of the final policy and the implementation. On that working group are several county directors of public health, and they're doing exactly what Dr. Tuckson said. They're concerned about it, and they're thinking of strategies about how to communicate a message that will make people more trusting of the vaccine. But also, I think there's real implementation problems. I mean, pharmacies are not equitably distributed across neighborhoods. Low-income neighborhoods where there are a lot of people of color at high risk have fewer pharmacies. They're not necessarily open at a time that's convenient. I mean, if you're working a full day or a double shift and you can't take time off from work without losing pay, where are you going to get the vaccine at a time that's convenient for you? And then if you get these side effects, which are really the vaccine starting to work to build up your immunity, and you have to take off work the next day, is that going to be feasible if you don't have sick leave, you don't have any control of your schedule, and you can't afford to lose the income or even your job if you don't show up for work? So these are the practical details that really make a difference for people, whether if they want to take the vaccine, we can provide it to them in a very feasible way.
Dr. Brown, I was sort of curious what you think the best way to reach at-risk communities is with the vaccines. I'm wondering if you've seen the same thing in Los Angeles. Here in San Francisco, there have had to be special testing events in the Mission District and really sort of a grassroots community effort to reach the Latino community. I'm wondering if in Los Angeles you've seen the same, and if you think that the vaccination push will sort of have to take a similar route.
I completely agree. We have seen the exact same types of things in Southern California. And I want to build on what Dr. Tuckson and Dr. Lowe said, that it's so important to have both a clear, trusted message, but also via trusted messengers. We have to make sure that the people bringing the information out to the community about the vaccines are people who are respected and trusted in the community. Who do not have the same baggage that maybe some of the health care researchers and even some health systems have. So we want to make sure that we have these partnerships in place so that the public understands that the message is about their safety and the long-term viability of their communities. I am a lead on the Stop COVID-19 initiative, which is an 11-site program across the state of California, in which we have 11 academic health centers who are partnered with a huge network of community partners. And the goal is to make sure that the community partners understand what's real, what's not real, really try to clear away the misinformation about COVID, about the vaccine and about the vaccine trials, and provide messages that are clear and give people the information that they need to make sure that they can talk to their healthcare professionals, talk to their communities about their questions about the vaccine. So I think it's so important to be clear, focused, and work within the broad range of communities that are at really high risk. And here in Los Angeles, that includes the Latino community, it includes the African American community, Native American, and Pacific Islanders who are at very high risk for poor outcomes from COVID.
If I can sneak in real quick also in a similar vein, it is extremely important who the messengers are. And so one of the things that we've done is to pull together the 4 historically Black medical schools, including Charles R. Drew University of Medicine and Science in Los Angeles, along with the National Medical Association, the National Black Nurses Association, all of them working in common cause. We've been producing town halls for the Black community all over the country now, gathering hundreds of thousands of people listening in to trusted voices that they can depend on, who they know these physicians and these nurses start from a position of love and empathy and compassion combined with scientific expertise and trustworthy information.
Yeah, trustworthy information, I think, is one of the keys, because I know you all have seen it. We've seen it. So many myths going around about COVID-19 and the vaccine. And it really is a big issue. And I want to share this question that we got from Di. She said, is it true that the vaccine will change our DNA? Can you answer that question for us?
No, not at all. Sorry.
No, go ahead.
I wanted to say, first of all, I don't want to alienate Di by any means, or anyone who has heard these misconceptions. And I think there's something for us to learn about what spread around at the beginning of the pandemic. That misinformation itself is probably more contagious than a lot of the diseases we actually deal with. Now, people just need to understand, like, the basics behind it is that the mRNA vaccine is literally just almost like a genetic wanted poster. And it's going to go into your cell. It's going to make a little image for your immune system to recognize, but it is by no means going to stick around and alter any other properties of your cell. It's not going to alter your DNA. There's nothing to worry about there. But she raises a really important question, because if you go online right now, and if people go look at unvalidated sources of information on Facebook, on Instagram, on Twitter, there's a lot of scary info out there. So I think moving forward, as the public starts to research more about the vaccine, and when it's time for people to sincerely consider, do I get the shot in my arm? They need to know where to get that right information from a trusted source.
And just to make it a really fine point on that, that the mRNA does not have the ability to get inside of the nucleus of the cell. And that's where the DNA is. So just to give her even more confidence, there's no way for it to get at the DNA to actually do that.
Thank you for answering that question, because we know there's so much misinformation out there. We so appreciated this conversation about equity and myths, and we want to include you more in this conversation. So make sure you go to Facebook, to YouTube, weigh in, interact with us. We'll ask questions that you post there, and follow up with our experts.
We are back with another break for our viewers on Facebook and YouTube. I'd love to continue that conversation, since we were sort of talking about how these vaccines are genetic vaccines, but they do not alter your DNA, or Dr. Tuckson, as you said, they do not enter the nucleus of your cells. Can you explain sort of what they all have in common? Obviously, Pfizer and Moderna are both mRNA vaccines, and then AstraZeneca and Johnson & Johnson use various adenoviruses. Do they all have something in common, though, in terms of genetically creating a vaccine or fighting the virus?
So I think quickly what they're all trying to do is stimulate an immune response to one of the virus's proteins. In this case, it's mostly what's called the spike protein. They just have different ways of doing it. But the end result of any of these vaccines is to leave you with your immune system ready and able to inactivate and prevent this virus from getting into your system and doing damage. And that's really, at the end, what we want to accomplish with these vaccines.
Well, and Dr. Reingold, I was talking to Susan Buckbinder right when we got the initial Pfizer data that was so exciting that it's 95% effective. And she said what was so great is that all the people manufacturing and researching these 4 main U.S. vaccines, they had all put their eggs in this spike protein basket. And that was a good sign that even though we don't have phase 3 data from Johnson & Johnson, and we're waiting for a little bit more information from AstraZeneca, that they would all be very strong vaccines.
Well, that's certainly what was hoped for, and so far the evidence is that that's correct. And I would point out that the very best vaccines we have against anything typically don't exceed 95 or 96% efficacy. So this is about as good as it gets when it comes to vaccines, frankly.
Well, and since we do have 2 huge blockbuster vaccines, we've got Pfizer and Moderna with 94, 95% efficacy, maybe 70% for AstraZeneca. We don't know with J&J yet. We know, and you know, that these are all fantastic and great options, but what if we get to the point later in the spring where people are like, well, I want Pfizer and Moderna because it's more effective? Will that ever be a reality for anyone?
You know, the reality is I don't know the answer to that. It's really hard to predict how many doses of which vaccines will be available where. You know, for the most part, for other diseases, we typically might have 2 or 3 manufacturers with different approaches and different vaccines against the same disease. And generally the patient is not presented with a range of options. Would you like this measles vaccine or that measles vaccine? So I think it would be unusual if we got to that point, but I don't know if it's going to happen or not, frankly.
Okay, thank you so much, Dr. Reigold. I think we are about to go back on television. We might have a few more seconds. We have 15 more seconds if anyone wants to weigh in on choosing vaccines.
I think people seem to.
We have some breaking news that we want to share with you. It's about the Moderna vaccine. The FDA has just issued emergency use authorization for this vaccine. The second vaccine for COVID-19. The first one we know is Pfizer. And we want to just check in with our panelists because this is news that we have been waiting for all day. And now we've gotten the official word from the FDA that they have issued this emergency use authorization. How big is this?
Huge.
Huge. It's epic.
You know, it was expected because the advisory panel, and I listened to it for hours yesterday, of course, voted 20 out of 21 people gave it the thumbs up in this FDA discussion. But it still means that we've got 5.9 million more vaccine doses coming to us next week. So you guys were all grinning, thumbs up. Dr. Patel, it's expected, but still a really exciting moment.
It's a very exciting moment. I mean, I could go on and on about how exciting this is. The fact that there was a global collaboration among scientists to get this done in such fast time without cutting any corners in safety. So it was done properly. And, you know, you mentioned this quickly, but I just wanted to reiterate again for people out there, the committee that actually reviews this is an independent review committee. It's a vaccine and related biologic products advisory committee. They have no stake in the game. They're looking at all the data objectively to say it's safe, and they did. And the FDA reviewed, took that recommendation into account. So this is great news to know that it's safe, it works, and that we are projected to get millions of those first shots into arms by the end of the year.
Yes.
I would also want to add to Dr. Patel's makes 2 points that are critical. Number one is this is a worldwide scientific achievement. And so those who are into the conspiracy theories that somehow or another this is a vaccine designed by people to injure people of color, for example, or whatever, this is something that was done by the collaboration of scientists from all over the world. And secondly, what is particularly key there is in terms of the review committee that Dr. Patel talked about. And I want to make sure that all people of color understand that on that committee was the president of the Meharry Medical College, an African-American man who was there specifically as a great scientist, but who also understands his responsibility to evaluate this and report back to people of color from a trusted, trustworthy source that says this is a safe vaccine. And I think those 2 points are critical.
Dr. Lowe, I think you wanted to jump in a moment ago.
I just wanted to add that in California, we have even an added layer of review. I mean, a common thing you hear is, do they really know that this works? Has it been rushed through? 11 Western states have said, in addition to the reviews that you just reported on, there's going to be yet another review by scientists in California and other Western states. So this is looked at as carefully as any vaccine, given the data we have. And so I think people can take some comfort in that there's a lot we still don't know, but what the data show has been very, very carefully looked at.
I want to ask you this question that we got from Larry, and it is about the vaccine. Now that we have 2 approved for emergency use authorization, let's get to this. Does the vaccine prevent COVID-19, or does it just decrease your chance of being hospitalized? Let's start with you, Dr. Brown. What would you say to Larry?
The vaccine does decrease your risk of getting COVID. It decreases your risk of being hospitalized, and it decreases your risk of death, really. So the vaccine does a lot. The thing to remember, though, is we don't know if the vaccine will prevent you, even if you get COVID, from transmitting it to others. So you still have to do what we've said over and over again: good hand washing and sanitation. you have to wear a mask, social distancing. So all those things are still critically important because we're still in the early phases of understanding how the vaccine works. But we do know that it works and it's effective in preventing COVID and preventing bad outcomes from COVID.
Well, and that sort of makes me curious. So AstraZeneca's vaccine is 70% effective in theory for the, if you're one of the 30% who might get COVID and you got the vaccine, would that mean that your disease would be less severe?
So that's a great question, and we don't know the answer to it. But we have evidence for other vaccines, for example, for influenza vaccine, that if you do get influenza despite being vaccinated, you on average are less sick, are less likely to be in an intensive care unit on a ventilator and things like that. So it is possible that the vaccine gives a certain amount of reduced risk of severe disease, even if you get disease. But I think we have a long way to go before we understand the AstraZeneca vaccine for a variety of reasons.
Yeah.
I think this is really important that we always, as physicians and as scientists, are able to admit when we don't know something. And until we see the data, we probably should not try to speculate, as I think we correctly just answered, that we need to be able to go through that data with a fine-tooth comb. And right now, we don't have visibility to that, and we probably need to take a very cautious position.
I want to bring up this question, too, from Angelica. It's kind of surrounding an issue where we are probably looking for more data and more information to answer. But if you can give her any insight, she's wondering about the details of the effects on vaccinations for pregnant or nursing moms. We also got questions about people who are wondering about the impact on kids. So what can you share with people about this based on the data that we have so far? We'll start.
Well, I would just quickly say the Advisory Committee on Immunization Practices for the CDC has weighed in on this subject, and I've personally dealt with it. I have a daughter who's a frontline healthcare provider who's has a 4-month-old and is breastfeeding. So this strikes close to home. At the moment, we have no reason to think that pregnant women who are at substantial risk of COVID should not be vaccinated, and the same is true for lactating women. Admittedly, we have very limited data, but my daughter is going to get vaccinated next week and continue to breastfeed.
Congratulations to your daughter, Dr.
Reingold. Tell your daughter we said right on, because I think, if you look at the American College of Obstetricians and Gynecologists and you look at the statements that have been put out, it's very clear that we know the risk of COVID-19 in this population. And we know that in many situations that far exceeds the theoretical risk of getting a vaccine. Now, in the actual studies, and one of the other panelists may know this number, which off the top of my head I don't, in the 2 studies, there were a number of women who became pregnant after enrolling in the trial, and there were no adverse side effects reported in that group. So that's reassuring. And but I do think it comes down to an individual decision. But right now, they are absolutely allowed to get the vaccine, and there should be no reports of them being denied the vaccine if they are a frontline provider.
You've come up with the issue of children has come up a couple of times, and the one area where the committee really struggled both times has been around the ages of 16 or 17 years of age, and that's where you really do need to seek guidance from your physician and really look at this very carefully. So that's an area where the only area really where there was any major real disagreement, as I could track it from the committee, was whether or not to make a recommendation for children who are in that age range of around 16 years old or thereabouts. So that's an area that's important. And if you have kids that age, you might want to check in with your personal physician.
Well, and Dr. Patel, we've had extensive conversations about vaccinating children, and we have a piece airing at 5 o'clock about just that with you, Dr. Patel. There are studies being done right now, Pfizer, Moderna, with teenagers, and you believe at some point they will start testing on younger children just to really ensure the safety, but then also what doses they might get, because it may be different than for adults.
Absolutely, and everyone on here will agree with me. I can't stand the phrase, kids are little adults or adults are big kids, because our bodies react to medications differently. There are examples of vaccines which have to be given in different doses for young children. And I think it'll be important to look at that age, especially the school age children, and what doses that will be great for them and their immune response. And again, as I mentioned at the top of the hour, that trial needs to have happened yesterday if we're going to actually get a long enough time for safety data And we have to also think about all the different communities out there where these kids are living and thriving and going to school. When we simply say things like, keep your child at home, and he or she's going to be safe there, that's a very insensitive, and it's not a very culturally competent thing to say, because some people drastically rely on their children's going to school in order to not only get nutrition, to get safety, so that they can go to work.
Dr. Patel, we've got to jump in. Thank you so much. We've got to go to break, but we're going to finish this conversation on Facebook and YouTube. All right, we're going to be right back with some final thoughts.
In the break. 3:20.
Okay, we have 3 minutes and 20 seconds in this break, and I know that this is a topic that we intended to get to, but I want to see if we can touch on it. It's about just making sure, well, not really making sure, but what the plan is going forward when we talk about enforcement of people taking this vaccine. Do you guys anticipate that there will be any enforcement, like maybe from someone's job or maybe to go to certain kind of events? Do you see that in the future when it comes to the vaccine?
There's been a lot of discussion about whether employers can require the employees to take the vaccine as a condition of being employed. It's been controversial. Lawyers have weighed in on both sides. But just in the last day or so, the Federal Office of Equal Economic Opportunity Commission has said that it is permissible, but with two caveats. You have to allow for exceptions if a person refuses a vaccine for religious reasons. That has to be accommodated. And secondly, if a person has a medical condition that's a contraindication to vaccination, and we've said those would be very rare, that it can't be mandated there. But beyond that, mandates in 2020, 2021 are not going to be very popular and effective. And I think it's really a matter of persuasion, helping people understand what's going on, and really listening to their concerns. I mean, people are ambivalent, they've heard things, and if people work through that, I think more people will say, okay, you've convinced me, where do I roll up my sleeve?
Yeah.
You know, I can tell you that at least as of this moment, the University of California system has decided that this vaccine will not be mandatory, and they may be strongly recommended, but workers will not be required to take the vaccine. And, you know, whether company A says you can't come into my plant unless you've been vaccinated, again, the lawyers, I'm sure, will have a field day with that.
I think Bernard really hits a very important point, which is the counterproductive nature of a mandate. If we started to do that and talk about that now, there are a lot of people that would run absolutely screaming in the other direction. This is not the time to be bringing that into the conversation, public, you know, in terms of a policy decision.
Yeah,
absolutely. Absolutely. I agree with you both. And it's so clear that if you have clear explanations and allow people to ask their questions, you end up with a much better outcome. And you're more likely to get people vaccinated and who feel comfortable that this was the right choice.
Thank you for your answers on that. I'm going to have to cut this part of our conversation short because we're getting ready to go back on air with just some final thoughts. I feel like we could keep talking about this, Kate. This was a good conversation.
I think we need another hour, 2-hour town hall vaccine.
Right?
It's gone like
quickly.
Like that. Yeah. Thank you so much, panelists. Well, thank you on air, but this has been fantastic.
We want to thank our panel of experts for taking the time out of their really busy schedules today. We know you guys are so busy to talk with us and to talk with you about all of the crucial questions surrounding the vaccine. This is really only the beginning of a really important conversation provided on our app and at abc7news.com. Thank you for joining us.